The first challenge is that we are dealing with often a group of very distressed patients. They've been suffering for a long time. Nobody suffers for a long time and gets away unscathed, unfortunately. Quite often we have to deal with people who find it difficult to understand what we're looking at with them when we say we're not going to cure your problem, but we are going to help. So it takes a lot of work in that regard. It takes alteration in one's thinking from standard ideas of how treatment should be in medicine, where on the face of it, it might be a relatively simple process. Diagnosis, treatment and cure. That's a simple way of doing things. Now, that's very rarely what happens in medicine, and it's almost never what happens in pain medicine. But that simplistic way of thinking is something that we have to change. And because that simplistic way of thinking is part of the core learning process in medicine, we actually have to start moving people away from that and asking them to explore different ways of helping people. There's a perennial problem that we're a relatively small specialty. The demand's very high. We can't help everybody, but for those that we can help, it's incredibly worthwhile.